Hello and welcome to All Things Seniors. This is your host, Rafiq. I have over 20 years of caregiving experience, and on this channel, I am empowering other caregivers one episode at a time. Today, we are going to discuss rising healthcare costs and how, as either we are seniors who are watching this channel or primary caregivers, how we can, as family, as users, prepare ourselves for these rising costs. So we'll talk about primarily three things. Number one, why is it happening? Number two, what can we do for our loved ones today? And number three, what as primary caregivers we can do to prepare ourselves for that inevitable future where these costs may be even higher. So let's start with number one, why is it happening? So if I ask myself why healthcare costs are rising, I primarily see two basic reasons. Number one, it's demand and supply. A lot of silver tsunami is happening around the world. Boomers, people from their 70s and 80s, like 1970s and 80s, have now reached a point where they are needing care. That was the biggest cohort of aging population that we are seeing today. So a lot of people are needing care. And on the other hand, if you see that in past 30 years or so, birth rate across the globe has gone down. Also, a lot of people are not entering the healthcare profession because they can see that there's a lot of stress in it. And on the other hand, computer and technology jobs have taken more prominence. So we are seeing a rising demand for services because of the way our population is aging. And on the other hand, the supply of care from the caregivers side is declining. Higher demand, less supply of care, higher prices. So that is one reason. The other reason, as you would imagine, that a lot of patented technology, like a new kind of a cane or a new kind of a walker or a new drug, a lot of these new technology things are coming up, which has a higher price tag to it as well. So from multiple fronts, prices are going higher, and we are seeing that seniors with fixed income or low income are finding it really difficult to match that gap, right? Like how do we afford these things? So that is one reason of that we're finding rising healthcare cost. What can we do about it? Let's talk about it in our segment 2. So now in our segment 2, we'll talk about 3 to 4 ways we as primary caregivers can arrange this care or sustenance, or how to take care of these rising healthcare cost tips, right, for our loved one. I would say number one is that if your loved one is still in an age bracket where you can arrange a long-term care insurance for them, many insurance companies provide that kind of insurance even if your loved one is 65, right? So up to 65 years of age, if you are a viewer of this channel or a primary caregiver who is taking care of a loved one around the age of 65-ish, you can still reach out to an insurance company and see if a long-term care insurance can still be purchased or obtained for your loved one. What it will do that in next now 5 to 10 years, when your loved one may be now 75 years and needing to either get home care arranged at their residence, like their home, or they have to move to another retirement home style facility, the additional cost can now be taken from that insurance policy that you would secure today. So I highly encourage for you to look for these things. In Canada, for example, there is an Ontario-based company who is providing a plan called My Dignity. If you are our viewers from outside of Canada, still go to My Dignity plan, see what are the key words that plan has, and then maybe take that theme to one of your local service providers from insurance perspective and seek if there is a local solution for a long-term care insurance policy in your region. So that would be my number one suggestion, like do it now kind of thing, okay? Number two, I would say is a lot of seniors, they continue to live in maybe their own house or a bungalow or an apartment like by themselves. And that is awesome if they can afford that lifestyle. But if you are seeing that their finances now may not allow them, or the rising healthcare cost is having a toll on their savings, one of the potential solutions could be some kind of a communal living. If them moving to a senior 55 plus building would now have a lower cost of, for example, maintaining a kitchen, because there could be a community kitchen, or maybe a healthcare service provider coming, and instead of providing 3 hours of care, which many private companies have like a bare minimum 3-hour visit. So let's say right now your loved one lives in their own home, a private company comes in, provides 3 hours of care. They have to take 3 hours of care because that's the minimum a private company would send their caregiver for. But if your loved one would be living in a communal setting, let's say a 55 plus building, maybe 3 or 4 older adults or seniors could now split that 3 hours of service, which many times is good enough, right? Like a 45 minutes coming and doing basic housekeeping or chopping some vegetables. That is the minimum care. You don't need sometimes all 3 hours. And that way your loved one would be able to split some of those costs. Also, maybe taking a cab and going for grocery shopping. Again, some of those costs can be split. So communal living is another way of saving some cost towards this home care, health care, rising inflationary pressures. We will be able to save some cost there. So that's my suggestion number 2. My suggestion number 3 today is multi-generational living. We have actually done another episode on multi-generational living, and you can find more details there. But in a nutshell, if your culture, your family practices are such that you could live in a multi-generational setting where, for example, you as a primary caregiver has a house where there is some capacity for your mom or dad to move in. Or if your mom or dad have a larger house and you are at a stage in your life where you are actually looking to move out of your rental and maybe move with your mom or dad, either way, if 2 generations can live together, I'll give you my example. In my example, in our house, we have my mom and dad, me, my wife, and my mother-in-law. So 2 generations live together. There is a lot of benefit in a way that I don't have to worry about, for example, healthy meals while I'm working long days, because I know that my mom has taken care of meal prep at home. Similarly, my mom and dad, they don't have to worry about home care because we can, for example, take them to doctor's appointments or, take care of grocery shopping and stuff like that. And both generations helping each other, we both can keep our costs low. And that is another way of keeping your health care costs low. See, I'm not saying it's for everyone, but if it works for you, that could be a good solution, at least for a period of time until you find the next chapter of your life. So that would be my point number 3, multi-generational living. Another thing that I would highly recommend you to, on an ongoing basis, keep an eye on is the regular health checkups and maintaining the health of your loved one. Going for regular checkups will maybe identify any challenges upfront so that we can take care of them rather than something becoming a big issue and it takes more resources, both in terms of time and dollars, so that regular health checkups are extremely important. And also, I think bodily strength, working on either a walk or, having dumbbells at your home, or maybe taking your loved one to gym on a regular basis, whatever is their requirement, whatever is their body's need at that time. But having physical exercise, physical strength, whatever is the way of having them more mobile, will in a way keep them active for longer and will need those home care style support a bit later in life. More and more we can have these support services a bit later in life. We'll be able to save as a family some costs now. No family has unlimited deep pockets, at least not many that I know of, and maybe if you know, great, awesome, good for you. But for people who have limited budget, we need to be mindful of those dollars that we are spending today. If we don't spend them today, they will last us a little longer. And I think that is one of the obligations that's on us. It's our responsibility to be, financially prudent for our loved ones. So that would be my next tip to be very mindful of. If you're liking this content, like this episode, comment something, because what YouTube does, YouTube will say, okay, it's a caregiver, it's liking this episode, let me show it to other caregivers as well, and that way we'll be able to share this content with more caregivers and be able to help more caregivers like ourselves, right? So I think that will help our entire community. Please do that. And the last point which I want to leave you with is, most of my viewers are primary caregivers. You are not yet at a point where you need home care. But let me emphasize that being an accountant, I can see some trends, and I follow the trend line of how the healthcare costs are rising and our incomes are not at that pace. Also, in future, we will have even lesser supply of primary caregivers until a day comes where we have robots taking care of us. Until that time comes, we will need our dollars to last long. So my suggestion to people like us, primary caregivers, look into those insurance options for yourself as well. If there is a home care or long-term care plan that you can buy, sooner you buy it. The way insurance works is, sooner, earlier stages of your life, if you get an insurance policy, your premiums will be less. You know, for example, I earlier said if your mom or dad is 65 years old, you could maybe still buy that program, but that would be a bit higher premium because the company knows you will come back very soon to ask for that money, right? But if, for example, if you're in your 40s, you have another 20-ish years of paying some premium, accumulate some savings there, and that way you'll be able to hopefully have more resources available in the years when you need them. So these were some of my tips. What are some of your tips? What have you found in a way to subsidize some of the costs? Please write in the comments. I would love to learn from you. I'm sure other caregivers would love to learn from you. Share the knowledge so that we all become better. And in the end, I always say, take care of yourself. Do take some rest, because a rested caregiver is a better caregiver. Thanks for watching this today, and I'll see you next week. Ciao.